Hi, this is Mary with Insect Shield, and I am thrilled to be here today with Dr. Alexis Chesney. She's a naturopathic physician, acupuncturist, author, and educator. She's written a book, Preventing Lyme and Other Tick-borne Disease. Welcome, Dr. Chesney.
Thank you, Mary. Thank you for having me. Great to be here.
Absolutely. First, I'd like to start if you could just give us your background and bio and kind of how you got to be where you are today.
Sure. So, I was always interested in going into medicine, and then I found out about naturopathic medical school as I was going through the MCAT and all of that testing, and I was really enlightened to find out that curriculum. So I went to the University of Bridgeport and finished my medical degree there, and then I moved up to Vermont for residency. I had no idea that I was really on the front lines of Lyme disease. And I actually trained with Dr. Richard Horowitz, a medical doctor in New York, who is incredible. He's a powerful leader in this field of Lyme and tick-borne disease. And it was just so great to spend time with him and learn from him. So I really learned a lot about pharmaceutical and antibiotics in the way of treating Lyme and tick-borne disease. But he also has a holistic approach. And he's very down to earth and funny and wonderful. So we could connect on some of that. And so it was really great to have that combination, that background in naturopathic medicine, and then really get the download on how to treat Lyme and tick-borne disease from that pharmaceutical, more allopathic perspective, and take that into the rest of my time, seeing just how affected Vermont and New Hampshire, that whole area in New England, is affected by Lyme and tick-borne disease. So that was about 13 or so years ago that I moved up to that area. And since then, yes, I've been working, full time with patients with those conditions and certainly other conditions too.
Yeah. So had you been interested in like kind of the insect, like in Lyme disease and other insect-borne disease, or was it because working with this doctor that and you saw all these patients that were struggling? Because it seemed, a lot of people that end up, they're kind of like really into ticks or really into like insects, but then you're coming from the medical side. Did it just happen to all come together and connect that had you focus on on insect-borne disease or mostly tick-borne disease?
In school, I actually had a really good friend that, developed what we realized was Lyme disease. And, over, months time, she just developed all these odd symptoms. We're all studying together, and it's a intensive time to be together and study, and just kind of watch this otherwise healthy young person sort of deteriorate. And I actually brought her to the doctor. I think it was the appointment that she was diagnosed, and it was just very eye-opening, and then to see her get better. And so I just got really interested also medically then. In Lyme disease at that point. And I had no idea, the intricacies of the research and science behind it, but also how, people can get misdiagnosed and there's underdiagnosis and that whole piece that I had no idea about. But I was really glad to learn and be able to become a resource for people who were really suffering. And we could actually identify what was going on, and still do, and, see people get better. So.
Yeah, and I would think, and one thing too, maybe you could just, naturopathic medicine versus allopathic is what you call kind of just for like more Western medicine, correct?
Yeah, conventional medicine.
Conventional medicine.
Yeah.
So what would you, just to describe to folks, like what is the big difference between the two and what kind of also overlaps?
Sure. So the first 2 years of naturopathic medical school is really the same. It's the basic sciences. And then it's the next 2 years where we're learning pharmaceutical, pharmacology, but we're also learning about nutrition and herbal medicine. We take counseling classes. Part of being a naturopath, I think, is that we really create more time with the patient. We don't have 10-minute visits, 20-minute visits. We have longer visits, so we can really try and dig into what's going on with people and get to the root cause. So the curriculum, is very much the same in the beginning, and then we branch out into all these other ways that we have tools and the philosophy of care that we do. And then after that, there's residency and boards, licensure.
Right.
So
one I would think too, with like Lyme disease, which the people that have long-term Lyme, especially that seem to have it is like a more holistic, a big overview approach is that much more important because often there's a lot of mental health struggles too, because going through being undiagnosed and not just coming into a doctor and saying, here's some, antibiotics and, see ya. There's probably many advantages to kind of a bigger assortment of remedies that can really say, okay, because seems like with a lot of the Lyme patients, there's a lot of things going wrong. It's not just like, boom, you do this and everything's fixed. It's really long-term and continual care required.
Yes, sometimes it is. And so sometimes we need to do a lot of medical detective work. And I love that. I like being able to take the time with my patient to get a really thorough medical history and think about, what might be missed and how else can I support them? Maybe some medical diagnoses that have been missed, but also, how can we support their immune system and their adrenals and their mental health, and how is diet and exercise, lifestyle, really looking at the whole picture, the whole person.
Yeah. And it seems, and even I was actually, besides, Lyme, but then just the tick-borne disease like alpha-gal, for example. I mean, that really is, nutrition becomes almost, the most critical and really focusing. I was working with some other, the two alpha-gals, they do a podcast and they're out educating folks, and just what they've learned through it's so much bigger than just going to the doctor and saying, here's some medicine. It's a continual and lifelong journey and constantly adjusting things that they have to battle to feel better.
Yeah. So alpha-gal will cause that allergy to certain mammalian meats, and really, there's no medication that will treat that. So it's really about finding out how sensitive you are, and how many foods you need to avoid, and it can affect even medication, supplements, body products. Just thinking through all of that, it can be a challenging disease to deal with.
Yeah. So just, I know it's not like kind of apples to apples, but when someone comes into you with, you're suspecting Lyme disease, and maybe, what are you doing differently than if someone just went to an allopathic doctor? Like, what would be kind of like an example of someone coming in, here's what's happening. Maybe they didn't have the rash, but with your experience in living where you have in Vermont or other places, thinking, okay, maybe this is a tick-borne disease. What do you do? Do you follow the same test, like the Western blot? And I'm not a big expert on the test, but I know there's a lot of controversy. The tests don't always work. How do you handle that situation?
Yeah. So I would take a similar approach regarding thinking through like a pretty regular medical approach, and thinking through differential diagnoses and taking a good history and that sort of thing. And then thinking about, well, do we need to test? How long has it been since a tick bite? Are we in an acute stage, or is this more that somebody has had these symptoms for a long time and we're in more of a chronic phase? But yes, there is that divide regarding testing and diagnosis, just in the medical community regarding what is used for Lyme and other tick-borne disease. So, I do use IGeneX, a very specific specialty lab that does excellent testing, high accuracy. So they have an immunoblot. Now they also have a culture-enhanced PCR, so a culture test, which is amazing. So we can actually find out if somebody has current active Lyme, for those who have had it for a long time, and we think maybe, hey, are we finished? You're doing better. Can we actually find that out? We use that test. So, but you can do a Western blot at a regular lab, and that's going to be better than an ELISA. because, certainly finances can play a role. A lot of times, these specialty labs are out of pocket. So I like to, have that conversation with my patient and, prioritize what we need to do. But the accuracy is so much better. So of course, knowing that, and usually if a patient comes to me from, their primary care to somebody who hasn't had extra training in Lyme or tick-borne disease, then, usually it's the ELISA, and that test is less than 50% accurate. So if it's negative, that perspective from that medical provider might be that you don't have Lyme, but I'm going to think more through it with my patient and maybe do more testing, even a trial of treatment, something like that. So testing is one way that it's more so, I think, the way I've been trained with other MDs as well as naturopaths and nurse practitioners who choose to, get this extra training through an organization like ILADS, the International Lyme and Associated Diseases Society. So then that's one way that's different. But then as a naturopathic doctor, of course, I have that perspective, and that probably comes in more, through just the way I might, think through the visit with the patient and hold space, and also, in treatments, and then how we check in and really looking at things more holistically. Sometimes something isn't Lyme, right? And so I help them through that, or there might be Lyme disease, but we might also have other things going on, and they might do well with something like physical therapy. So I also look at that team approach and thinking of, who else do we need on their team to help them through this healing journey? I think that's really important too. And so then when we get into treatment, if we just, stick to something simple like Lyme disease, I might in the beginning, if they've never been treated before, especially if it's an acute Lyme case, then I do use pharmaceutical antibiotics. But I'm also always thinking about the different ways that Lyme exists and hide. So I'm always going to add something in addition to thinking about the spirochete bacteria that Lyme is. We're going to need to add something for that round form. And there's research like over, the last 10 plus years now showing that this is one of the ways that Lyme changes. And that's why it makes it so hard to treat Lyme, because it can change. It's really sneaky. It's a survivor. And so we want to add something, often a natural sort of therapy, like herbs like, knotweed or cat's claw, andrographis. And now we're getting, more and more research on these herbs from institutions like Johns Hopkins, which is excellent. So in the last 5 years, that's something that's really blossomed. We're seeing more funding from the NIH, different institutions really studying these things, kind of validating, the work I've been doing, saying, yes, actually it does work. It does actually kill Lyme, and sometimes better than other antibiotics that are commonly used. So that's how it might be different. I might be adding some other therapies in the beginning, and then usually I transition at some point to natural therapies. And there's so many that we have. Another thing we need to think about is biofilm. So that's another way that Lyme hides in the system. And that's also some not so recent anymore, but more recent, in the last 10 years
What
or
is
so.
that
Biofilm?
Yeah. Okay. I'm not familiar with that. Yeah.
So this is a fibrin layer.
Okay.
That's the bacteria. Basically, they come together and create a community. So you've got a bunch of spirochete bacteria together, and they kind of wall themselves off, create this little fibrin layer, this little shell. And then it's really fascinating. I mean, they have communication going on in there. They have a whole waste removal system, and then they can, put out different little other biofilms, and it's just the way that they survive. So antibiotics won't get through those biofilms, but some herbs do, and things like serrapeptase, like an enzyme, will digest through it. Some essential oils now we're seeing can break through that. Stevia is one thing that was researched that can break through that. So, so it's really important to address all these ways that Lyme exists and hide, which has made it so difficult to just use conventional medical training to really treat and eradicate. And maybe some people do fine with that, right? If they just take doxycycline, I'm not saying that everybody will not successfully do well through that treatment. But of course, the people I see probably are that 10 to 20% that have been shown to continue to have symptoms. Research shows that they continue to have symptoms after regular treatment has been provided for Lyme disease. So it's really, and when you think of how many cases, we're having at least 350,000 new cases of Lyme every year. And some research says it was like 476,000, something like that. So, 10 to 20% of that every year, that's a lot of people. So, really trying to be comprehensive in the treatment and treating long enough is really important. And then so later on, of course, I'm using a lot of natural therapies. And so, a lot of MDs I work with do too, because, at ILADS, it's really wonderful. It's a place where researchers and clinicians come together to learn from each other and share ideas. So, I might learn a little bit more about pharmaceuticals from my mentor, but I also teach and, learn from others also about natural therapies. So it's great. We just want to help patients get better. And it's like,
so
what works?
Let's do it. So is it like 10 to 20% that like, if the number, obviously the number, no one knows the numbers because there's been a lot of people that don't even believe, that Lyme is a thing, but I think that's changing. But is what you all research, is it like 10 to 20% of people that get Lyme end up with like kind of the long-term Lyme? Is that kind of what?
Oh, and this is agreed upon by everybody. This is, CDC. If you go to the CDC website, they will say that. It's the persistent symptoms is what's agreed upon. The cause of it, which sometimes might, our perspective is it might be a persistent infection, but that part is not agreed upon. Is it, an immune effect, like an autoimmune process that's going on? Sure, maybe. Also, it could be. I think that happens. Is it a persistent infection? Is it, what else could be going on? Is it damage that's happened? That's the big question of why are these folks sick? Yeah.
Right. Well, I think, and then so 13 years ago, I think the conversations were different about just, about tick-borne disease, also about, where it is. You were in the hot spot in, New England, but that it is all of the United States, the continental, at least, and Alaska probably are affected by tick-borne disease. And one thing I found interesting, I don't know if it's something's happening. Granted, I'm talking to a lot of people about tick-borne disease, and I lived a little bit in this world, more so now. But I feel like this spring, I don't know, with the CDC came out with a report more about babesiosis numbers were increased. And I get my little Google alerts for, just what's happening. I feel like there is possibly a sea change in people really getting in the news, talking about it, just in all communities saying, hey, ticks, they're more and more. If it was a very mild winter throughout a lot of the US, not everywhere. But I feel like there is like a conversation's happening. And I was we work with Dr. Thomas Mather, University of Rhode Island. He runs a Tick Encounter Resource Center.
Yeah, amazing resource.
Yeah, he's fantastic. And he does a lot of work for us and helping just get the word out in education and prevention. But, we were saying how, sunscreen, 20 years ago, or when 40, 35 years ago, when we would just like, how burnt can we get? And that has changed now. And it's like, gosh, you can't even go outside without your sunscreen. And do you feel any change happening? Like maybe we're at a point where like the seriousness of tick-borne disease and so many different diseases, and it's not just Lyme, and it's not just in Connecticut and Vermont and Massachusetts. Do you feel a change? I don't know. I feel like I'm seeing something.
I think so. Yeah, I'm hopeful. Absolutely. I think it takes slow steps to make that change. But there is more funding for research. I think that makes a big effect. There's a lot more education to the public going on. There are a lot of wonderful advocacy groups that have popped up just in the last 5-10 years. So all of these efforts on all these different ways, is going to impact the public, and more research to come as well. Yeah.
Yeah, I hope it is. Well, and one thing too that I'd love to that how we connected is that you through your book, Preventing Lyme and Other Tick-borne Disease, that part of the conversation though has not been how do we prevent people getting tick bites in the first place? It's been so much like how do we heal people that have tick bites? And you're like,
Yeah.
and I think, it's so what inspired you to say, okay, wait a second, like we got to go back to the beginning because if people didn't get tick bites, then we wouldn't be running into this. And I think the resources have gone so much to like let's prevent or like let's how do we like heal people that are sick and like as opposed to let's have people not get sick. And that's so what inspired you to say, okay, I'm actually going to write a book and get this published, and seeing that need because there really isn't that much in the news of like preventing. It's more like just make sure you take there's some small tips, but it's more about when you find a tick on you, here's what you need to do, or if you find not like how do you not get a tick on you in the first place. So
yeah, I just I value education. That's a big piece of my relationship with my patients, and prevention is one of the principles of naturopathic medicine. So, after a while, as I'm seeing people come back, they may first come to me with Lyme disease and I might diagnose them, or they may have been diagnosed before. Anyway, we go through the process of healing. They're doing better. I'm so excited. They're happy. They're getting back to their lives. They're going outdoors in the beautiful New England landscape. And, then I see them come back in a year with a new tick bite. And or maybe a new bullseye rash. That happens sometimes, not always, but and then just having that happen over and over. I started creating this handout that would just talk about tips, tick checks and permethrin treatment of clothing, and different things. And I'm like, please, you have to, and then I'd just be more and more passionate about giving that to people. And somebody said, I think once, you should just write a book about this, because the handout kept getting longer and longer. As I learned more, I'm like, wait, we need to get some better, tick checks. Like, what did we do before that? Repellents, a lot of my folks and myself, are interested in natural repellents, or, anyway, tick tubes, all these different things that I learned about myself to then share with my patients. And what I did was I did a little ebook myself. And then I got a phone call from Story Publishing saying, we would love to do a book. We want you to submit a manuscript and work with one of our editors and illustrators. And I was thrilled, so that was an amazing process working with them. And then to get it out in hard copy to people, poor illustrator had to draw so many ticks. That was quite a process. But, part of what I'm passionate about is, doing tick identification and knowing, is this a tick that can carry pathogens? Yeah. If so, which ones? You can test the tick, just kind of bringing people from prevention and let's not get Lyme in the first place through every step of the way, because actually there are many steps of the way, right? And, an asymptomatic tick bite versus a symptomatic tick bite. I mean, so the book just kind of brings people through all that, and hopefully in a helpful way that can equip them with, picking at least one thing. I love to talk to patients year to year, and it'll be like, 1 year, oh, you know what, we're doing the permethrin, we're doing our shoes. All right, great. We've got it on the calendar. I'm like, put it on the calendar. Right. I do it every 6 weeks, put it on, remind me, get them all out, spray them down. And then the next year they say, oh, okay. I'm like, well, what about tick tubes? You have this yard and you're talking about the dog going out and bringing in ticks. I'm like, all right, I'm going to do that this year, so it's great. Just little by little, planting the seed that maybe just take on one other preventative method. And it really makes the difference. And I hear about how, people are getting less tick bites, maybe no tick bites. So it makes a huge difference. And if we could end, at this point, really we can end Lyme and tick-borne disease through prevention. I mean, that's my ultimate passion. Absolutely.
Yeah, no, that's it's a worthy cause. And I believe we agree. I mean, it's interesting. Yeah. Cause we're, Insect Shield, and we have a product that can, permethrin works against ticks, and that's well known. And there's just some easy things: spraying your shoes, wearing some socks, just some really basics. And just people, if you know how ticks work, and that's why, we're Dr. Mather, we've done some work. Just okay, they're on the ground, they're crawling up, they're, where they're hanging out. And we just did a video with him, just the myths of, ticks, like they don't fall from trees. And he'd agree. He's like, he said, I think it was such a good point. The amount of energy it would take a tick to climb up a tree and then try to drop on you, like, just having people really think like, okay, how's a tick hanging out? Where is it going to be? And how then it could get onto you. And then that's, again, education and learning about easy ways to help protect yourself. But then and then if you are bitten, that, is at least even taking a picture of the tick, like so you can identify the tick, knowing, I mean, I don't think a lot of people don't even know they can save the tick, or they should save the tick, and little things like that can make a huge difference. So, books like yours and getting the word out, it just helped, to end the scourge of the, the tick bite, and still being able to enjoy nature. I think that's at the end, that's what everyone wants. You still want to go outside and be able to enjoy being outside.
Exactly. Yes. Because then people can get really scared after they have been through or know someone who's gone through Lyme. So I love being outdoors, and it's so gorgeous in the area where I worked. And we want to get out there and enjoy.
Yeah. No, and it's even too, just reminding folks, I feel is important. I mean, I'm living, in just a suburb of a, semi-large city. Just last week, it was 2 days ago, because I was taking the dog out. Even in my little neighborhood, there's deer. All of a sudden, there's a family of 5 deer running in the backyards. There's a creek right behind. So I'm sure there's the mice, and just so many people also have to remember, it's the everyday, like you said, it's the backyard. And reminding too, it's not just when you're going out on some big adventure into the woods, to make sure, just like you said, it's like sunscreen. You should have it, kind of all the time. Make, all your shoes you're wearing out to, just to, walk the dog and just, go out in the yard, making sure you're protected. So I'm sure,
Absolutely.
things like,
it's part of the everyday.
Yeah. Well, thank you so much. I think, and we will definitely put a link below to your book. I believe you can buy it on your website. And is it on other?
It's anywhere you buy books.
Okay,
you can get it on Amazon. You can ask your local independent bookstore to carry it if they don't already. You can get a signed copy if you go through my website, if you're interested in such a thing.
When I also saw too on your website, you have a really great presentation that kind of really talks about all the different types of ticks and things. So I highly recommend folks check that out if they really want to get into the nuts and bolts of ticks and what they're doing and all the different types and the different diseases. Because that's the other thing I think too, remembering it's not just Lyme, because Lyme gets the talk, and it's many different ticks, different,
really important,
depending where you are.
Lyme, babesia, as you said, absolutely. Yeah, it depends on that geographic location, which ticks are in those areas, and then each tick has a different pathogen profile. So, I talk all about that. I also have tick bite clinics. Several years ago, I decided, because I was working with so many chronically ill folks, that would be ongoing for a while. But I thought, well, we need to, intervene right in the beginning, and people need this education. So I do have appointments that become available for people that have just had a tick bite, and whether they're symptomatic or not, we can talk about what to do. I have a whole prophylaxis regimen that I recommend to people if they'd like. And then also if they are symptomatic, then, we're into the whole different phase of probably dealing with the disease, and then, going from there too.
Excellent. Well, that's great. We'll put links to all that on the bottom of the page. Well, thank you so much for sharing all of your information and what you do. And hopefully we'll work with you to get rid of the tick-borne disease.
Yes. Well, you're so important in that fight. Absolutely. I respect and appreciate Insect Shield so much, because you've made a huge difference in the lives of my patients and myself.
That's great. Yeah, no, and that's what, we have a commercial product, but it also can really do a lot of good for a lot of people. So we're really, and we're trying to support as much as we can, getting the word out and saying how easy it is to protect yourself and to still be able to enjoy outside.
Well, thank you, Mary.
Thank you so much.